Well, the results were incredible, actually. I thought it might be useful for some people, but I didn't expect the findings that we got, which is universally positive. So over the 3 groups we tried it with, patients, staff members and relatives of critically ill patients, everybody, 100% of people found it useful. We only had 4 minor negative comments out of 59 uses, and pain scores improved, especially in patients with higher pain scores, more than 6 out of 10. Anxiety levels improved and mood improved. And then the feedback we had several themes came out, which was themes of relaxation, escape from the reality that they were in, that they weren't enjoying, positive feelings and recommendation that others should use it. And several people said this should be an essential piece of kit in every intensive care unit.
My name's Chris Wilcoxon. I'm 47 years old and I've got 2 children. Isla, my daughter, who's 10, and Lewis, my son, who's 6, and my partner, Sally.
So Chris is one of our patients who was with us for many months. He was critically ill in multi-organ failure in the intensive care unit for a long time. And during that time he had severe pain, he had anxiety and panic attacks, and he was really struggling. He was in a dark place. I was very keen to try the virtual reality with him, and he ended up loving it.
I was just concerned for my family and my partner, really, and I was really in a bad way. I was having probably 20 panic attacks a day, I would guess. And it was very difficult for the staff to try and get me out of those panic attacks because I just wouldn't listen. They couldn't calm me, really. So yeah, it was quite a bad period of time for a couple of months. I'm not sure I would have stopped having the panic attacks at all.
And it's just a nice personal touch for me to come and spend some time with them, let them escape from what's actually going on, because obviously it's not a nice place to be, and I give them that out for a little bit of time. I obviously show them all the experiences that are available to them. They choose which experience they'd like to receive, and then I pop the headset on with the earphones for about 10 minutes and let them just escape from their reality.
He was asking to do it every day, and he said that got him through that really difficult and dark time. He then went on, after leaving intensive care, to go to a general ward. He had to have surgery to amputate one of his toes, and because of his general health being so poor, he was unable to have a general anaesthetic, so he needed to have this surgery under local anaesthetic, requiring him to stay awake. And he managed to get through the surgery without having to resort to a general anaesthetic or to cancel the whole thing.
I'm not sure what I would have done in terms of the surgery I had, because I think I would have been, I quite likely would have started having more panic attacks again if I hadn't have used the virtual reality while having the surgery, because it can be quite a traumatic thing to see and hear, and I'm not sure how long I could have carried on the way I was without something worse happening, if I'm being honest.
We've got a couple of patients who were suicidal, attempted to take their own lives, and then a few days down the line tried the virtual reality, and both of them said, 2 in particular, said that it made them feel happy and took them away from their sad reality for a few minutes. And I think if something can make that difference to somebody who's so low in mood, that it's amazing.
I think I always had a positive outlook on virtual reality before we started. I thought that it was going to be quite successful, but to have 100% positive feedback, I don't think any of us were expecting that. And just to see the personal benefits that it's brought to our patients as well has been amazing. So yeah, it's really exceeded our expectations.
I think the potential benefits for VR in the healthcare industry are enormous. I'm just looking at one specific field, and even in the field of anaesthetics and intensive care, we could use it for pain reduction, anxiety, stress relief, rehabilitation, and using it for staff and relatives. Escape Innovations have been very helpful. They lent us the kit free of charge for the purposes of this study, with no expectation that we were going to have positive findings. I explained that if we had negative findings, we would still publicise those, and they were still happy for us to have the kit. So there's been loads of interest. Initially, I think people were a bit suspicious and wondering what on earth we were doing with this virtual reality kit, but as people have seen for themselves the benefits that the patients have experienced and how happy the patients are after using it, more and more staff have come to ask if they can use it for their patients. Some of the surgeons want to use it more for doing procedures under local anaesthetic, and some other specialties are interested in using it for their patient populations. So I think the use will become more widespread as people find out more about it.